So essentially one of the meta problems of healthcare today is rapidly upskilling the workforce to help treat COVID-19 patients. And that's a challenge we took on alongside Mount Sinai to truly scale personalized learning across the US and help support the different hospitals. Essentially, we've developed a curriculum that covers all of the critical topics that the hospital workers need in order to treat COVID-19 patients. And we're delivering that in a platform that personalizes the learning to the individual needs of the specific nurse in this case. So depending on their specific knowledge gaps and their specific knowledge level, the system will adapt the content and serve just what they need right when they need it.
Joel, where is this available right now? Is it just within the Mount Sinai Hospital ecosystem, and are you charging anything for this service?
So this is provided fully pro bono alongside Mount Sinai and available to all hospitals. It's truly through the partnership that New York Academy of Sciences set up in order to develop this platform and provide it to hospitals all across the US that are having this urgent need to upskill their workforces. So this curriculum we developed pro bono alongside Arizona State University as well as health workers at Mount Sinai that are seeing the need in the hospitals. And we're just hoping that it will reach as many as possible in order to serve the hospital's needs.
Joel, have you been able to scale it up to any other hospitals? Where else are you looking to go after this?
Yes, of course. We're already seeing an additional sort of dozens of hospitals adopting it. And alongside other programs, we've had tens of thousands of users on the platform already, healthcare workers treating COVID-19 patients. So now our initial focus is within the Mount Sinai group and as well as other hospitals in New York, but we're hoping to really serve hospitals across the country in the next few days.
And Joel, there's a big shortage of intensive care nurses right now and respiratory therapists. How does your AI technology help them?
Of course. So what we're seeing is an immense need to upskill nurses who previously haven't served in the ICU units, for example. And these nurses then need rapid upskilling on the skills required to help serve in the ICU units. Essentially what the system can do is meet these nurses at their individual skills level. So some of the nurses might already know 20% of the content, others might know 60% of it, some might be completely new to a lot of the concepts. Essentially the system, through a quick adaptive assessment and then through continuous personalization, can meet them where they're at and rapidly upskill them to help support in the ICU units. So it's really a tool that will allow us to upskill the workforce where it's needed the most.
All right, Joe Hellermark, CEO of Sana Labs, doing some important work out there in the healthcare space. Stay safe. We'll talk to you soon.
Thanks a lot.
All right, now time.